Hi, I'm Chloe. I'm going to be your student nurse today. Can you tell me your name and your date of birth?
Yes, Peyton Wyatt and 12/7/2000.
Okay, great. I'm just going to provide for some privacy here for us. Are you comfortable?
Mm-hmm.
Okay, great. Can you tell me where you are and what time it is?
Yes, at the hospital, and it's 12:30.
Okay, great. So first thing we're going to be assessing is your face. So I'm just going to note that the face is symmetric, the color is a tan, there's no hypo or hyperpigmentation, temperature is warm, moisture is dry. Now just pull down your lips like this for me, and I'm going to note that the color is pinker than the rest of the body, moist, and there's no cracks or lesions. Now I am going to assess the eyes, and I'm just going to note that the pupils are round and equal in size bilaterally. And then I'm just going to have you look at my nose for me. Okay, great. And I would note that the pupils converge and constrict. And then I'm going to have you look at the wall for me, and then look at my finger. Great. So accommodation test is present in patient's pupils. They diverge and converge. And then for your ear assessment, I'm just going to make note that you're responding and you are responding appropriately in our conversation. Next, I'm going to assess your neck. And just looking at it, I'm going to say that the color is even throughout the rest of your body, that tan. I don't see any lumps, lesions, or masses. I'm going to palpate the trachea. And I would say there's no deviation and it is midline. I'm going to palpate the carotid artery one at a time. And I would note that the pulse is strong and with a 2+ strength. And then I'm going to have you lay down. And usually I would remove the pillow. And I'm going to have you turn your neck this way and the other way. And I'm going to note there's no pulsations or JVD, and you can go ahead and sit back up for me. Next, we're going to move on to your chest and your lungs. Upon inspection, I'm going to note that the color is even throughout the rest of the body. The tan, I don't see any lesions, lumps, or edema. The temperature is warm, moisture is dry. And I'm going to go ahead and palpate, starting above the clavicle. I kind of go around, down. Let me know if you feel any pain or tenderness. Any pain or tenderness? Nope. Okay, so I would note that patient felt no pain or tenderness, and there were no lumps or masses felt. Next, I am going to palpate the radial pulse, as if I was counting respirations, and I'm going to note that it would be 12 to 20 beats per minute after listening for an entire minute, and that breath sounds were unlabored. And now I'm going to listen to your lung fields. I'm going to clean my stethoscope and listening with my diaphragm. I just want you to take a breath each time I move my stethoscope. Okay, go ahead and lift your arm up for me. I'm going to listen to your lateral fields. Breathe in and out. Great, other arm. Okay, great. I would note that no adventitious sounds were heard, and breathing was unlabored and even. And if you'll turn around for me, I'm going to assess the posterior chest. So upon inspection, I'm going to note that the color is even throughout, and I don't see any lesions, lumps, no discoloration. The posterior chest is symmetrical with an elliptical shape, or the anterior chest has an elliptical shape, but the posterior chest has that symmetric downward shape of the ribs. So I'm going to go ahead, clean my stethoscope again, and I'm going to listen to your lung fields. Okay, just breathe in and out each time I move the stethoscope. Okay, great. I would note that there were no adventitious sounds and the lung fields are clear. And now I'm going to percuss at the costovertebral angle at the 12th rib. Just let me know if you feel any pain or tenderness. Any pain or tenderness? No. Okay, great. So I would note that no pain or tenderness felt at the costovertebral angle. You can go ahead and turn back around for me. Now we're going to move on to your heart. And I'm going to go ahead and percuss at the apex, the base, the left sternal border, and I'm going to note that I didn't see a heave or feel a throw. And I'm going to go ahead and clean my stethoscope again. And I'm going to listen to the apical impulse in the 5th intercostal space, medial to the midclavicular line. And I'm going to listen for an entire minute, and I would hear 60 to 100 beats per minute, and I heard a short, gentle tap. Now I'm going to listen to the rest of your areas of your heart. So I'm going to clean my stethoscope again, and I'm going to start at the aortic area in the 2nd intercostal space to the right. And then right across to the left in the 2nd intercostal space, the pulmonic. And in the 3rd intercostal space underneath on the left, Erb's point. And then in the 5th intercostal space, the tricuspid area to the left of the sternal border. And then the mitral area, 5th intercostal space, medial to the midclavicular line. And I'm going to go ahead and do that again with my bell. So aortic, pulmonic, Erb's point, tricuspid, and mitral. And I'm going to note that the rate and rhythm of the sound were regular with no sinus arrhythmia and no pulse deficient. And I would note that S1 was heard louder at the apex and S2 was heard louder at the base. Next, can you lay on your left side for me? So I'm going to listen at the apex with my bell. And I'm going to be listening at the 5th intercostal space, medial to the midclavicular line. And I'm going to note that I heard no S3 or S4 extra heart sounds. And you can go ahead and sit back up for me. And I'm going to have you just lean in a little bit like this. And then listening with my, clean my stethoscope, listening with my diaphragm. Just breathe in and out for me. Okay, so no diastolic murmur was heard. Okay, and next we're going to go on to your abdomen. So just go ahead and lay down for me. Okay. Upon inspection, the abdomen is an even color throughout the rest of the body, tan color. There are no pulsations or lesions present. I'm going to check the shape. And the shape is flat of the abdomen. And then I'm going to inspect the umbilicus and I would note that it is midline, inverted, there's no discoloration, and then go ahead and lift your head up a little bit for me. Okay, so there is no hernia present. Now I'm going to clean my stethoscope again, and I'm going to listen to all 4 quadrants. I would note that vowel sounds were heard as the gurgling high-pitched and frequency was irregular. Now I am going to palpate your abdomen, just about 1 centimeter in all 4 quadrants. Let me know if you feel any pain or tenderness. Any pain or tenderness? Okay, so I would note that patient felt no pain or tenderness. I didn't feel any masses, and rigidity was present, or no rigidity present. And then that's it for your abdomen. I'm going to go ahead and have you sit up. And for our musculoskeletal, I'm going to start with your upper extremities. So I'm just going to note that extremities are equal and appropriate in size bilaterally. Color is even throughout. I don't see any deformities, no bruising or varicose veins. I don't see any lesions or masses. I'm going to palpate. Just let me know if you feel any pain. Any pain? Okay, so I would note no pain or tenderness upon palpitation. Temperature is warm and moisture is dry. I'm going to go ahead and inspect the fingernails. I'm going to note that the size is appropriate. There's no clubbing present. Consistency is strong and smooth. And capillary refill is in 1 second. Next, I'm going to assess your brachial pulse. And I would note that the rate and rhythm was regular with the 2+ strength. And then I'm going to palpate the radial pulse, and the rate and rhythm was regular with a 2+ strength. And as well as for respirations, I'm going to palpate here, and I should hear about 12 to 20 respirations per minute. Okay, and next we are going to test your range of motion of your elbows. So go ahead and do this for me. And then pronation and supination. Okay, great. So I would note that patient had full range of motion and had no pain, tenderness, or crepitation upon pronating, flexing, and extending their elbows. So now I'm going to go ahead and test the muscle strength of your elbow. So go ahead and try to flex for me, okay, and extend. And the other one. Okay, great. So I would note that patient maintained flexion with resistance. And then now we're going to move on to your lower extremities. So I'm just going to note that the color of the lower extremities are even throughout the rest of the body, a tan color. I don't see any deformities. They are equal in size and appropriate bilaterally. I don't see any bruises, lumps, masses, or lesions. There is some varicose veins present in the calf. And then I'm going to go ahead and palpate your joints at the hips. Let me know if you feel any pain or tenderness. The knees, the ankles, feet, and the toes. Any pain or tenderness? Okay, great. So I would note that patient felt no pain or tenderness upon palpitation. The temperature of the skin is warm, moisture is dry. I didn't feel any lumps or masses. Now I'm going to palpate the posterior tibial, which is inside the ankle here. And I would note that it's a 1+ strength. And then I'm going to feel for the dorsalis pedis pulse, and I would note that that was also a 1+ strength. I'm going to assess the toenails, and I would note that the shape is regular, consistent, strong, and smooth. Capillary refill within 1 second, and no signs of clubbing. Now we're going to test your muscular strength of your lower extremities. So I'm gonna go ahead, you go ahead and try to flex your leg for me. Okay, other one. Okay, great. So I would note that patient had maintained flexion with resistance. So I'm gonna go ahead and act like you're pressing down on a gas pedal. Okay, and then flex your foot upward. Okay, great. I would note that patient also maintained flexion and plantar flexion and plantar dorsiflexion upon resistance. Now we're going to assess the neurologic assessment. So go ahead and grip both fingers for me. Okay, great. So I would note that patient had good strength in both hands bilaterally. And then with the mental status, I'm just going to note that the patient was listening and responding appropriately throughout the entire assessment. Their behavior and their presentation or their appearance was appropriate. And they were alert and oriented. And then I'm just gonna, do you need anything else? Do you have any more questions for me? Are you comfortable?
Mm-hmm.
Okay, great. I'm gonna lower their bedside table, or their bed, and make sure they have their bedside table and their call light by them. And thank you so much for having me.
Mm-hmm.